Okay, guys, welcome back. When we're talking about obstructive shock, this is caused by mechanical obstruction that actually prevents an adequate volume of blood from filling the heart chambers themselves. Okay, so we do not have a pump problem anymore. Okay, now we have something that's actually blocking our fluid from returning to the pump. Okay, and there is a couple different things that can actually cause this, and I'm only going to hold it to these three examples for you guys at the basic level. We're going to talk about cardiac tamponades. We're going to talk about a tension pneumothorax, and we're going to talk again about pulmonary embolisms. Okay, so when we're talking about cardiac tamponade is a collection of fluid between what's known as the pericardial sac and the myocardium. Okay, there's your heart is lined by something called the pericardial sac, and this can give us some problems both with trauma and both medical. The actual sac itself kind of encapsulates the heart, and the heart, it does this in order for the heart muscles to not actually rub up on the inside of our wall, kind of like the pleural space on the lungs. Our lungs kind of sit in a sac as well. This is kind of like that with the heart. It covers the heart. It provides safety, cushioning a little bit, not much, just a little bit. It holds in moisture. It holds in nutrients and electrolytes for our heart in order for our heart to function. And we can bleed into this area. And when we bleed into this area, when we're actually bleeding from the myocardium of our heart, of the musculature of our heart, we can actually start forcing that blood to push down on our heart because it's encapsulated within the pericardial sac. And really what this does is it prevents the actual ventricles from filling up with blood, both the right and the left. If we're not able to fill our ventricles appropriately, we're going to significantly decrease our cardiac output. So we're going to see significant drops in blood pressure. We're going to see, or what we might be able to hear, what we called muffled heart tones when we actually listen to the heart. And again, this is more of a paramedic thing. Or we can actually see JVD. Remember, that's that jugular vein distension where our blood is actually starting to back up because we're not filling our ventricles accordingly. Okay, those three signs and symptoms are known as Beck's triad. Okay, and we don't spend too much time on Beck's triad in basic land. You guys can read up on that in your textbook on what exactly is Beck's triad. But Beck's triad is a low blood pressure, it is muffled heart tones, and it's the signs or presence of jugular vein distension. Okay, when we're talking about a tension pneumothorax, tension pneumothorax is the accumulation of air within the intrathoracic cavity. So we have caused some kind of damage to our lung tissues. More than likely, we have popped a hole in our lungs. We're still breathing normally. We don't have a problem with ventilation. We're still moving air in and out of our lungs. However, that air is not staying in our lungs, and it's starting to collapse our lungs. So let's say I get shot in my right chest, okay, and the bullet doesn't go through. We're going to talk about bullets going through and staying in the body and trauma. But I have a bullet that goes right to my right lung, okay? Obviously popped a hole in it. I'm still breathing accordingly. But because I'm breathing, right, the air, all right, may not be able to escape my chest. That pressure might be building up into my chest where it's starting to collapse my lung, right? So my right lung is starting to kind of move to the left side of my chest because all of that air is starting to build up, and I need to be able to release that tension, okay, which I can't do. I have too much positive pressure in a negative chamber cavity. Because of this, it's going to start shifting all of my major vessels, all of my great vessels, my heart, and my left lung to the left because my right lung is damaged and my right side of my chest is filling up with air. So everything's starting to move over to the left side of my chest. Okay, so the lung collapses and the air supply pressures to all the organs, including the heart, and the great vessels. So I'm starting to squeeze my heart. I'm starting to squeeze my aorta and my superior inferior vena cava, and I am significantly slowing down cardiac output. Okay. Now I want to talk about tension pneumothorax in a minute. Tension pneumothorax, they always ask that we want to make sure that the trachea of the patient in the throat, when we're looking at the throat of the patient, that the trachea is midline. The trachea is where it's supposed to be. When we do have a significant tension pneumothorax, we can actually see the trachea in the throat displaced either to the right or left, depending on where the actual hole in the lung is. Okay? So I'm going to tell you right now, guys, I have never seen a tension pneumothorax on a live person before. Okay? I'm sure it's happened. I'm sure there's some medics out there that say, "Oh, I've seen it all the time," right? I'm sure they're out there, right? Myself personally, and I've asked other medics as well, some of my really close friends, have you seen a tension pneumothorax, right? I've never seen it on a live person. Whenever I've seen a tension pneumothorax, they have been dead for quite some time. It takes a lot, right? And most of the time, from my understanding, when you do see a tension pneumothorax, more than likely your patient has already expired. So, once again, obstructive shock is basically cardiogenic shock. However, it's not because it is a cardiac problem. This is something from outside in, or a possibility of some kind of lung disorder that actually affects the heart. Okay? So, yes, the obstructive shock, once again, our container is the normal size. Our pipes are the normal size. We have enough fluid within those pipes in the containers in order to create an adequate amount of pressure. But because of these outside kind of influences or these intrinsic factors kind of coming in, unfortunately, the heart takes the grunt of this, and the heart will actually stop to pump when it comes to an obstructive shock. So, cardiogenic shock and obstructive shock are both dealing with some sort of pump failure itself.